Despite that horrible record death toll today in Victoria, there is again evidence that the infection curve has flattened, with 410 new cases, meaning they've been well under 500 now for 7 days in a row, ranging mainly between 300 and 400. Of the deaths, 70% have been aged over 80, 90% aged over 70. And the overwhelming majority of deaths have been occurring in aged care facilities. Across the country now, more than 60% of all COVID-19 deaths have occurred in aged care. But in Victoria, the tally is 189, or 3/4 of all deaths in aged care homes. Now, we know the elderly are more susceptible, but clearly the calls that have been made loud and strong on this program and elsewhere since early March to make sure we do everything to protect these facilities have not been heeded. Our coronavirus problems can largely be attributed now to two failures: the quarantine failure in Victoria and the aged care failure. The Aged Care Royal Commission is hearing as much from experts.
This is the worst disaster that's still unfolding before my eyes, and it's the worst in my entire career. I didn't think we'd sink any lower following the Royal Commission findings from last year, and yet we have. In my opinion, hundreds of residents are and will die prematurely because people have failed to act.
Now, again, we know it's difficult. If the virus is in the community, it's hard to keep it out of aged care. But as we're hearing in the Royal Commission, there is more that could have been done, more that needs to be done to ramp up testing and refine practices to reduce outbreaks, and also to put quick responses in place when there are outbreaks to get the elderly into the best care and prevent the virus running through these centres. We are again left with the paradox of Melbourne being under curfew and suffering stage 4 lockdowns when the really vulnerable, the people who are really at risk and who are losing their lives, are the people who are already effectively locked down in aged care facilities.